This is the website for the Event201 or 201, which took place in October 2019 in New York. It was basically a global pandemic exercise, as it says in the subtitle, a simulation of an outbreak of a global pandemic based on a coronavirus. Now, mind you, October 18th, 2019. Let me read the scenario. You can find that website under centerforhealthsecurity.org/event201/about. Here's the scenario. Event201 simulates an outbreak of a novel zoonotic coronavirus transmitted from bats to pigs to people that eventually becomes efficiently transmissible from person to person, leading to a severe pandemic. The pathogen and the disease it causes are modeled largely on SARS, but it is more transmissible in the community setting by people with mild symptoms. The disease starts in pig farms in Brazil, quietly and slowly at first, but then it starts to spread more rapidly in healthcare settings. When it starts to spread efficiently from person to person in the low-income, densely packed neighborhoods of some of the megacities in South America, the epidemic explodes. It is first exported by air travel to Portugal, the United States and China, and then to many other countries. Although at first some countries are able to control it, it continues to spread and be reintroduced, and eventually no country can maintain control. There is no possibility of a vaccine being available in the first year. There is a fictional antiviral drug that can help the sick, but not significantly limit the spread of the disease. Well, it starts with I, doesn't it? Since the whole human population is susceptible during the initial months of the pandemic, the cumulative number of cases increases exponentially, doubling every week. And as the cases and deaths accumulate, the economic and societal consequences become increasingly severe. The scenario ends at the 18-month point with 65 million deaths. The pandemic is beginning to slow due to the decreasing number of susceptible people. The pandemic will continue at some rate until there is an effective vaccine, or until 80 to 90% of the global population has been exposed. From that point on, it is likely to be an endemic childhood disease. Now, what I want to play you is the address of a WHO representative to the visitors of that event.
Greetings, distinguished guests, and thank you for this opportunity to say a few words at this year's Event 201, the high-level simulation exercise for pandemic preparedness and response, hosted by Johns Hopkins Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation, Unfortunately, I was not able to join you today. I'm involved in the IHR Emergency Committee for Ebola. I don't think we've ever been in a situation where we have had to respond to so many health emergencies at once. This is a new normal. This is a new normal. A new normal. A new normal. The scenario you will be presented with this morning could easily become a shared reality one day.
The scenario you will be presented with this morning could easily become a shared reality one day.
I fully expect that we will be confronted by a fast-moving, highly lethal pandemic of a respiratory pathogen.
I fully expect that we will be confronted by a fast-moving, highly lethal pandemic of a respiratory pathogen.
Question is, are we prepared to globally respond to the next major pandemic event?